Hi, my name is Morgan Stevens and I'm a PN student at Wilson State College, and today I'll be showing you how to perform some bowel skills. My partner will now scan the room. Thank you. So I've previously seen my patient and she came in with a primary diagnosis of congestive heart failure, but I know she's dealing with some constipation because she hasn't had a bowel movement in the last 3 days. So I've already assessed her bowel sounds and they're hypoactive, so I'm just going to be comparing my MAR to my provider's orders. So I have Shirley Coast, 54-year-old female, so that matches up. Shirley Coast, 54-year-old female. 5/14/1964, so that's perfect. 5/14/1964. Dr. Leo, and then room 211-1. So that's perfect. All matches up. And then I'm gonna just check my medication. So I'll do my hand hygiene. Okay, so first, it seems because of the constipation she's in and the pain, she gets, we have on here a Dulcolax Suppository 10 milligram rectal daily PRN for constipation. So that's as needed, so we will be administering that since it's been about 3 days since she's had bowel movement and she's in some discomfort and has some distension because of all that stool in her abdomen. Okay, so now I'm gonna pretend I'm in the med room and I would compare my Pexis to her name. I would see Shirley Coast, date of birth 5/14/1964, perfect. And so now I'm gonna put on my gloves. Okay, perfect. So now I'm in my med room, and then I have my Dulcolax right here. So I'm going to be doing my first med check. So I have Dulcolax Suppository 10 milligram rectal daily PRN for constipation, and they're right here. They're not liquefied or anything. They aren't dissolved or anything. There's no tears or anything on the bottle. The expiration date is good. So I know that that's good, and it is Dulcolax Suppository 10 ml rectal daily PRN. Okay, perfect. So since I've done my first check, now I'll move on to my second. So I have my lube. So I'm going to put my lube in here, in this cup, and then I'm going to be placing one of my suppositories in there. Oh, we got one too many. There we go. And then we'll have one in there. And then that's being lubed just for comfort for the patient. And then the patient label would also go on here. So then we have Dulcolax Suppository 10 ml rectal daily PRN for constipation. And that's perfect for Shirley Coast. And then I'm just double checking this. So Dulcolax Suppository, perfect. All matches up with here. Expiration date is good. So I'll set this here. Okay. Perfect. So then I'd put this back. I would check my sheets, make sure, and then I would remove my gloves, perform hand hygiene, and I would leave the bedroom. So now I'm going to the patient's room. I don't have my gloves on, but I'm going to leave them on for demo purposes. Hi, Shirley. My name's Morgan. How are you doing? Okay, you're in a bit of discomfort. Okay, can you just verify your name and date of birth for me? Okay, Shirley Coast. Okay, perfect. That's what I have here. And your date of birth? 5/14/1964. Perfect. Thank you. And I do see you have an allergy. What is your allergy? Penicillin and codeine? Okay. So what I'm going to be administering today doesn't have any of those, so don't worry about that, okay? Okay, I'm just going to double check that with your wristband. Perfect. Perfect. Everything checks out. Shirley Coast. Date of birth 5/14/1964. So that's perfect. So Shirley, do you know what I'm going to be administering today? Yes, a suppository. Have you had one of those before? Okay. And you have good sphincter control? Okay, sounds good. So you're gonna be in a left lateral Sims position, and so you're just gonna have that right leg bent up, and I'll have you go to that side if that's okay, okay? Okay, so I'm just gonna do my third med check, and I would add any more lube that needs to be to my suppository, and then I have my Dulcolax suppository 10 mils rectal daily PRN for constipation. Okay, perfect. So that all matches up. There's enough lube. Okay, perfect. So now I'm gonna help Shirley. Okay, Shirley, I'll try and provide as much privacy for you. I raised the bed to a comfortable position so I don't hurt my back. I'm gonna just turn you over. Thank you. Make sure your head stays on. And then I'm gonna spin your leg how we would do it. Okay. And then I placed this chucks here just for demo purposes so it's easier. And I'll have that here. So I'd have that. And then I'm gonna have you hold your breath, Shirley, and then I'm gonna insert it, okay? Are you still doing good? Yep, you are. Okay, perfect. So I'm gonna grab my suppository, and then I'm just gonna open the buttocks just a little bit for help. Okay, ready? 1, 2, 3. And then I'd insert that 1 to 3 inches past the internal sphincter. Okay, Shirley, are you still doing good? And then I would change my gloves, and I dispose of this per policy. And then I'm gonna just have Shirley roll over. How are you doing, Shirley? Doing good? Okay. Okay, Shirley, so since you told me it takes a little bit for your suppository to kick in and you have good sphincter control, I'm gonna set your collet right up here, right next to you, and I'm gonna put you in a comfortable position. I'd raise down the bed, and then I'd make sure Shirley's comfortable. Are you doing okay? Yep. Okay, and then I would document that. I would say that Shirley tolerated that well. And then Shirley, when you get the urge, just hit your call light and I'll come, okay? Okay, so I've taken off my gloves, I've cleaned my supplies, and then I'm gonna leave the room. Okay, so it's been about 12 hours and Shirley hasn't had any relief, unfortunately. So I'm gonna look at my orders. So I have Shirley Coast, 54-year-old female, date of birth 5/14/1964, Dr. Leo, room 211. Perfect. So it says on my physician's orders, sodium phosphate enema, 4.5 ounces, bottle rectal daily PRN for constipation. Administer for constipation if unrelieved by suppository. So that is true. So we'll be administering the enema. Okay, perfect. So I'm just going to check that matches up with my MAR. So we have sodium phosphate enema, 4.5 ounces, bottle rectal daily PRN for constipation not relieved by suppository. And that's perfect, and that's for PRN, so as needed. So we are good. And so now I'm in the med room. I've performed hand hygiene. I have my gloves on. And then I'm going to be doing my first med check. And if I was grabbing this from a bin, I'd make sure that it verified with her name. So Shirley Coast. Perfect. And then date of birth 5/14/1964. Perfect. So then I'm just going to be taking this out. And then I'm going to be checking. Okay. So we have sodium phosphate enema, 4.5 ounces, bottle rectal daily PRN. Perfect. And the expiration date is 2026. So that's good. There are no particles floating around. I know that's good, and I already know that it comes with a pre-lubricated tip, but I'll bring some lube when I go into Shirley's room just to add more for comfort. And so that's good. I've checked that. The bottle's good. Okay, perfect. I'll just put that back in there. And then I'm going to warm this before I go in, just under warm water, and then I'll test it on the inside of my wrist just to make sure it's not too hot for Shirley. Okay, perfect. So now I'm going to do my second check. So we have my sodium phosphate enema, perfect, 4.5 ounces, bottle rectal daily PRN. So that works and that matches, perfect. And there's no tears. My bottle is ready to go, and I have my lube. And then this is for Shirley Cost, 5/14/1964. Perfect. Okay, so now I am able to go into move. So I take off my gloves. I bring the supplies I need, and then I'd head to Shirley's room again. Hi Shirley, how are you? Still no relief? Okay, yes, I understand. That must be quite hard. Okay, so what we're gonna do, I don't know if you know this, we're gonna be administering an enema. Okay. Oh, you've had one before. Okay, perfect. So Shirley, can I just get you to verify your name and date of birth for me? 5/14/1964. Perfect. And Shirley Coast? Okay, great. And then I'm just going to be double checking with your wristband. Perfect. So Shirley, we're going to have you in that same position, but I'm going to have you lay there just for a little bit, and I'm going to do some charting if you feel the need, because I know that you have a lot of stool and it's ready for you to have a BM, okay? So is that okay if I just close the curtain when I'm done and do some charting? Okay, yes. Okay, perfect, Shirley. So what I'm going to do is I'm going to be putting a bath blanket on first, just in case if we have any leakage or anything, your linens don't get dirty. And I would have put new gloves on and performed hand hygiene when I entered the room. How are you doing today, Shirley? Did you watch anything good? Yeah? Oh, you did? That sounds like quite a fun show. Okay, Shirley. Do you feel comfortable? You do? Okay. Perfect. I'm just going to lay this way. And then we're going to go in that same position, okay? So before I get started, I'll be doing my third check. So I'm going to get this down. I would pre-lube the tip. Okay, perfect. So then I've got this is also have a label on it if need be. So I've got the sodium phosphate enema 4.5 mils rectal daily PRN. I've checked the expiration date 2026. There's no particles floating around, and I'm good to insert and start the procedure. So I make sure this is set on a clean surface. And so Shirley, I'm just going to help you roll over, okay? Just move your head so you don't fall off the bed. Okay, so it's kind of hard with these mannequins, but she would be like this, and I try and have as much privacy as possible. Okay, so perfect. Just gonna lay you there, Shirley. Thank you. Okay, Shirley, I'm gonna have you take a deep breath. Okay. Okay, sounds good. Do you have any other questions? No? Okay. So then I would make sure this is still warm for Shirley, and then I go 1, 2, 3, and I'd insert this about 3 to 4 inches, making sure I have all the fluid. Okay, and then once that's done, then I would get rid of this per policy orders, and then I would change my gloves, and then I'd have Shirley stay like this, and then I would put up her rail, put new gloves on. I would document the procedure, what time I gave it at, and then I would do some charting and make sure she's handling you all. I'd stay in the room. I'd let her have some privacy, and then she feels like she's gonna have a bowel movement, so I'd put new gloves on, and then I'm gonna come over for Shirley. Okay, Shirley, so I'm just going to be putting this underneath, and then we're going to be rolling with it, okay? Here, Shirley. Let me see, Shirley. So she'd be rolling onto it, as it's kind of hard for these mannequins, but going to be like this. And then I would have Shirley, I would cover her up, but for demo purposes we'll be showing. So she'd be like this. It'd be scooted back if need be. But yep, it'd be like this. I would cover her, and then I would let her, I would move the bed to like a 90-degree angle so it's easy for her to have a BM or if need be. And then I would cover up, have privacy. I'd change my gloves, make sure my workspace is clean. And then when she says she's done, I go, okay, Shirley. So it's been about 5 minutes and Shirley said she had a bowel movement. Okay, Shirley. So I'm just gonna help you. I'm gonna roll you with one hand and I'm gonna hold this down so nothing splatters or anything, okay? Okay, perfect. So I'd roll and make sure to put this on a new table with the new chucks, but for this demo, we'll just pretend that's right there. And then she would be turned, and then I would clean up any BM or anything need be. I'd check for back sores or anything, and then I would make sure she's doing okay, and then I would roll her back over. You're just still doing okay, Shirley? Okay, perfect. Okay, so I'm just gonna make sure like this. So then I'd make sure to put new gloves on. I'd make sure to intake, I know, but I know from previously looking at my patient's orders that she has, the doctor wants a stool sample. So I'd have new gloves on, perform hand hygiene. So it says Shirley Coast, 5/14/1964. Okay, Shirley Coast, perfect. And the new orders are collected stool samples, staff, at 12 o'clock. So right now it's about 11:45, so that's perfect. So now I'm gonna just be putting my supplies, switching around, and I'm just gonna be grabbing what I need now. Okay, perfect. Okay. Okay, so I know she needs a stool sample. I'm gonna open that up. I'm gonna grab my pen, and then I'd be putting new gloves on, and then with my tongue depressor, I'm gonna be collecting about 1 to 3 inches for my stool sample. Okay, so that looks a little bit mucousy. So here we go. There, oh, that looks like good. There we go. Okay, perfect. Then I can throw that away. And then I would cap this. I'd be putting on new gloves before that and doing hand hygiene, just because that's a bodily fluid. And then I would be writing the stool, the room, the date, and the initials. Here, we'll do this one. Perfect. So stool. So time, 11:45. Perfect. And then date 10/26/20. Perfect. And then initials. Okay. And then I would put this in my biohazard bag, and then I would zip it up and make sure that it gets to the lab within 15 minutes, or either me or CNA would take it there. But then I would go to the lab, and then I would get tested. So then I can put that aside because that is done. I document that I did that, and then after this, I could document any I know, and I clean this out how I'm supposed to. So I'm just gonna leave this here, and then I'm gonna grab my new supplies. Okay, perfect. Okay, so this is just nurse care, and I would have cleaned my hands, put on new gloves, and I'm gonna be, I saw that Shirley's bag last time I was in was about halfway full, so I'm just gonna be putting a new colostomy bag on her today. So I've got all my supplies. I've made sure that I'm good. I've got a rag for her. I've got all my supplies, and so now I'm good to go in. So, hi Shirley, how are you? You're okay? Okay, so I've seen it's been a couple months and you have a colostomy bag. Okay. Is it okay if I change that? Okay, perfect. So can you just verify your name and date of birth? Okay, 5/14/1964. Perfect. And then Shirley Coast. Okay, I'm just gonna double check that. Perfect, Shirley. So I'm just gonna have you just sit up a little bit, not so your abdomen is distended or anything, but just so it's easier for me. Okay, perfect. So Shirley, what I'm gonna do is I'm gonna listen to your bowel sounds. Oops, sorry, Shirley. And I'm sorry, I'm gonna try and provide as much privacy. And then I would assess that soma, make sure the skin's okay, everything's all right. Okay, perfect, Shirley. So, how are you doing? Are you doing okay? So I'm just gonna be removing that, and then I'm gonna be prepping everything else, okay? Okay, sounds good, Shirley. So I'm gonna be, let me get my garbage. There we go. And then I'd be putting on new gloves. I would have performed skin hygiene and putting on new gloves. And so now, if I needed to, I would have some adhesive, but I'm gonna go from the corners in. I wouldn't go from down. I wouldn't go from up to down, so I'm gonna go from the corners in. And then I'm made sure that this is locked or secure. That's good. Okay, perfect. Then we'll just go. There we go. And then I'd hurry up and put this in here. And then if need be, I would wipe this. And then I'd be getting a new one and placing it over. How are you doing, Shirley? Okay? Okay. So then I'd assess this and do my I-know if need be. But I'll just set this right here. I'd assess for any abnormal colors, anything like that. And then your bowel sounds did sound hyperactive, so that is good, Shirley. Okay, so now that I have everything, I'm just going to be making sure. Perfect. Okay, and Shirley, you're still doing okay? Okay, sounds good. So since we've cleaned that, I'm just going to take my adhesive remover and remove all of that just so that your next stoma works, but I'm going to be trying not to press or hard or anything. Perfect. So now I'm going to be measuring your new stoma. Okay. So that's about a little bit bigger than 7/8 of an inch. Okay. So right about there. Okay, perfect. You're still doing okay, Shirley? And then I'd make sure to set this down. I should have set it down right after I was done measuring it. So I have this. So I'm gonna get this ready, and then I'm gonna put my stoma powder and paste, and then put my new one on. So I would open this up, put new gloves on, and then with my scissors, I'm gonna be cutting about a little bit bigger than 7/8 of an inch. And I'm gonna try not to do any jagged lines because I know that's uncomfortable for the patient. Trying to get it as circle as possible. So I'm just going to be double checking this because I don't want to cut it too small where the circulation is off, but I don't want to be cutting it too big where too much is being exposed. So it just needs to be a little bit rounded more. And in a clinical setting, I'd make sure for no jagged edges, but because this is just for demo, I'm just gonna pretend that I have it all perfect. Okay. Let's see. So just do that a little bit bigger because I don't want to cut off any circulation. Okay. Okay, so perfect. So then if it was too small, I could always, if it's just a little bit, pull in or anything. So now that I've got that, now I can clip this on, and I made sure to lock my bag. So I'm gonna clip this on. So I've gotten all the clicks. I know it's good. Okay, perfect. And then before I do that, I would take my stoma powder. Just put this outside the stoma. Perfect. And then if I needed any more adhesive remover, I would do that. Okay, perfect. And then now I would make sure to put new gloves on. And I'd be putting new paste on, a thin layer. And now I'm just gonna be removing this and then placing this on. Okay, perfect. And so then I make sure to hold this down and get all the sides without trying to put too much pressure. If I needed to make sure and hold this for a couple minutes, I would. So then I've got this all around. So you can see there's skin around it, but it's not cutting off any circulation or anything. So it's good. And then I would make sure and to put that down. Perfect. Okay. And then bag should be going vertical. And then Shirley could put that to the side or however she'd like. And then I'd make sure to change my gloves and have everything. And then I'll grab my stethoscope and pretend it didn't fall in the trash. And then I'm going to be listening to all 4 quadrants again. Okay, perfect. So 1, 2, 3, 4. Okay, so those sound like some hyperactive bowel sounds. So that's good, Shirley. I would document all of my procedures. I would see how she tolerated them. I'd take in I'd take in characteristics. I'd take in consideration how she's doing. I would make sure this is up. I would take off this bath blanket and put her new linens on. I would dispose of this in the linen bag, but for right now, I'll just put that there. And then I'd clean up my workspace. I'd put in everything need be. I would not leave Shirley cold like this, and then make sure to leave up. And then I would have her sitting how she needs to be. And also, I know that when I place the bag, it would be vertical and not like this. I didn't mean to do that, but I know in a real setting, you would have it this way. Okay, Shirley, are you doing good? Okay, sounds good, Shirley. So I'm just gonna be documenting everything. I take off my gloves, and then I would come back and assess Shirley later. Thank you.